This Christmas, I just want to congratulate you for all the care that you've given to our patients through the year, and on behalf of those patients to thank you for everything that we've achieved together on their behalf. And when I say our patients, I mean the over 500,000 people that we've seen through outpatients, the over 100,000 people who have been admitted to our medical, surgical and paediatric wards, the over 3,000 children who have been born, the 150,000 people who have come through our emergency departments, and the 100,000 people that our community teams have supported. Thank you for what you've done, congratulations on what you've achieved, and happy Christmas.
I just want to thank everybody for what's been a really challenging year. We've seen significant increases in our non-elective demand, but despite that, we've managed to sustain our performance for our 4-hour standard in the top quartile of the country, which just shows what amazing efforts everybody working together can do.
First of all, I want to say thank you to all of our staff for everything that they've done this year. And in particular for me, it's been about keeping all of our patients safe, and we've had a significant reduction in falls, for example, and that's been a huge effort from all of our teams across the board, nurses, doctors, and all of our allied health professionals.
Our biggest quality achievement in the last year has been the reduction in mortality. In 1 year, the summary hospital mortality index has fallen from 110 to 100, which is a 10% reduction in 1 year. I think the main reason for this is the reduction in sepsis mortality, which has gone down 36% in the last 2 years. And that's due to the better screening of sepsis, mainly in the EDs, but also on all of the wards, and getting the antibiotics in really quickly. So well done to everybody involved.
One of the biggest achievements that we've had this year is coming out of quality special measures in June. The CQC did their inspection in March, and they commented on how people had stopped them as they were going around and wanted to tell them about all of the amazing things that they'd done. They also commented that the feedback they'd had from patients was really, really positive and amazing.
Two years ago, our average deficit each month was nearly £6 million. Now it's nearly £3 million. That's still too high, but it's a real improvement, and we've got plans to bring it down to the level it needs to be in the future. I just want to say thank you to you and all your teams for the hard work involved in getting to this great point.
I would like to say thank you for the gradual changes in culture within the Trust and to the move to more values-based behaviours. I would also like to say thank you for all the work in relation to recruitment of hard-to-fill posts, and to those of you who have completed your staff surveys and have the flu vaccinations.
We've been supporting all the corporate and divisional teams to develop their plans moving forward, and we've focused particularly on sustainability. We want to make sure that through a programme of innovation and transformation, we're able to offer outstanding experience and outcomes for our patients in the future.
So we've just come to the end of the last board meeting of the year, and actually my last board meeting ever after 3 years. I've really enjoyed at the Trust. And the purpose of getting together and joining this film is for the board to say to you, thank you very much indeed for all the work you've done this year. It's been absolutely terrific. And we'd like to wish you a very happy Christmas.